Nations are on a hospital building and medical worker hiring spree. Britain is bracing for droves of desperately ill people while the virus has slowed its growth in Italy. ABC's Julia McFarlane has the latest from London.
Italy is now entering the fourth week of its harsh national lockdown. The country has seen over 12,000 deaths from the new coronavirus, around a third of the global total, and more than 100,000 cases. But in recent weeks, a slowdown in the number of new reported infections is giving Italians hope. This is the Maggiore Hospital in Parma, Italy, about an hour and a half away from Milan in the north of the country, which has seen the most intense outbreaks. The emergency department now nearly empty after the number of cases appeared to peak in mid-March. Doctors hoping that the worst might be behind them. The head of the department at Parma Hospital confirming a drop in the number of admissions. The new infections have been declining. This is probably because of the restrictive measures that have been enacted by the government. They have been truly fruitful. We absolutely have to maintain vigilance. But health professionals there are still fighting a war against COVID-19, and they say they are still lacking in proper safety equipment. Daniela Confalonieri making an emotional plea on camera. She says all medical staff in Lombardy and Italy have been left on their own with face masks. A lot of people worked without any proper protection tools, like myself. Julia McFarlane, ABC News, London.
We are now going to go live in Albany, where Governor Cuomo is updating us on the coronavirus. Let's listen in.
Go visit upstate New York if you want to talk about rural areas. We have rural areas, and just the way it's gone through rural New York, it will go through rural America. Total numbers, 83,000 tested positive, 12,000 people currently hospitalized. That's up 1,200 people, 3,000 people in ICU. 6,000 patients discharged. That's up 1,167. People go into the hospital, they get better, they leave the hospital. Most impacted states, New York is at 83,000. New Jersey is at 18,000. That's Governor Phil Murphy, who's been a great partner to me, a great partner to the people of this state. Governor Ned Lamont, also in Connecticut, has been a great partner. We've done a lot of great work as a region, which is very unusual. You know, those lines between states often become walls, not with Governor Murphy and not with Governor Lamont. We're working together, and we're going to work cooperatively with New Jersey because they have a real problem. California's ticking up. Michigan's ticking up. Florida is even ticking up. Massachusetts, but no one is anywhere near where we are, right? 83,000 compared to 18. Number of deaths, 1,900, up from 1,550. That number will continue to go up. That is people who have been on ventilators for a period of time. If you go on a ventilator, there's roughly only a 20% chance that you will come off the ventilator. The longer you're on the ventilator, the lower the chance you come off. We're still looking for a curve. We're still looking to see where we hit the plateau. Total number of new hospitalized. Again, you see the number goes up and down, but the overall trajectory of the number is up. Change in ICU admissions, bounce here, bounce there, but the overall number is still up. Change in intubations, same thing. The line is basically a line that is going up. Change in number of discharged, line is going up. Why? More people going in, more people treated, more people coming out. Everyone asks the same questions, and they're all good questions. When is this going to be over? What happens? How does it end? And people want answers. I understand people want answers. I want answers. But the answer is nobody knows for sure. Anyone who goes on cable TV and says, or network TV and says, this is what is going to happen, it's not true. Nobody knows what's going to happen. And I understand the need for closure, the need for control. We're at a place we've never been before. We're out of control. I need to know. Nobody can tell you. What you do know are facts. And, you know, facts are funny things. What you're now getting are subjective facts. People who are optimists want to interpret it one way. People who are pessimists want to interpret the other way. People who bring their own subjective agenda tend to interpret the numbers a different way. For me, facts are facts. And the facts that we offer the people of this state and the people of this country, they're not pessimistic facts or optimistic facts. They're not interpreted facts. They are just the best information we have as of this time. And I think that is empowering and in some ways relaxing. As I've mentioned to you who've worked with me, I say to my team all the time, I'm interested in your opinion, but I'm interested in your opinion second. I'm interested in the facts first. And give me the facts unjaded by your opinion. Because once a person has an opinion or once a person wants a certain outcome and they look at the facts through that filter, then you can interpret facts differently. Just give me the straight facts. Sergeant Joe Friday, just the facts, ma'am, just the facts. No opinion. There's something empowering to that. We look for the facts to projection models. That's how we gauge what we do. We follow the projection model. Every day you get additional data, they run that data into the model and they refine the model. And basically we then have a composite model because you have many different people out there with many different models. We use McKinsey, which is a consultant to the state, for this purpose, to basically look at all the models and come up with a composite model. And if people wonder, well, where do you get these numbers, Governor? How do you decide what you're going to do? We have a model, we have a projection, and that's what we follow. The current model, and the model, by the way, even more maddening, the model changes the more data that comes in. Because they started with assumptions and presumptions. And then the more data that comes in either affirms or discounts their presumptions that they started with. So they refine the model over time, and the model changes and the numbers change. But what we're looking at now is the apex, top of the curve, roughly at the end of April, which means another month of this. The apex, the recent number is you could need 110,000 COVID beds. What does that mean? Beds for COVID people, as opposed to other people who are in the hospitals for other reasons. 37,000 ventilators. That is our current model. That model is based on minimum or minimal impact from social distancing. Meaning what? One of the great variables is how effective is the social distancing? Are people doing it? Are they complying with it? And to what extent and how effective is it? Nobody knows that answer. So they do different projections depending on how well social distancing works, how well people comply with it, and then how effective it is. Minimal social distancing impact is where we get the 110,000, 37,000 ventilators. High compliance with social distancing, you still have 75,000 COVID beds as opposed to 110, you're 25,000 ventilators, okay? So when I keep pushing for high compliance on social distancing, it's because high compliance on social distancing will reduce the number. This is what they began talking about, flatten the curve, flatten the curve, flatten the curve with social distancing. This says, this is the difference between high compliance with social distancing and less compliance. If you have high compliance, you're down to 75,000 COVID beds, 25,000 ventilators. Less, it goes up to 110 and 37. Interestingly, both are looking at the same point of apex. It's just a lower apex. Both models say you apex at the end of April, just a lower need at that apex. And that is what we want, because this all comes down to, at the apex, can your hospital system manage the volume of people coming into the hospital system? That's all this is about at the final analysis. Now, there are also different models out there based on different presumptions. People studied China, people studied Wuhan. Well, if you have the same compliance that you had in Wuhan, Wuhan basically just locked up society. I don't even know that if the federal government enacted the Wuhan model that the American people would comply. We have a totally different social structure, governmental structure. So you have different models that project higher or lower. What we're doing with McKinsey is studying all of them and coming up with a moderate model that is a basis for us to make planning decisions, because I have to make decisions. And I want to make the decisions off the numbers, so that's what we're doing. It's not to say that there aren't other people with other opinions. There are many people with many opinions. And some have the apex happening sooner, some have the apex happening later. You can find people who believe the apex will come in 7 days. You can have people who say the apex won't come for 6 weeks. You have that kind of range. You have a broad range on the number of beds. You have a broad range on the number of ventilators. Our course, for planning purposes, is a moderate model, because in truth, the higher models, we don't even have a chance at meeting that capacity anyway. You say over 110,000 beds. There is no possible way we could get there. So in some ways, an overly aggressive estimate doesn't even mean anything to us, because it's just unachievable. People ask, well, what's going to happen? And Dr. Fauci said yesterday or the day before, the days blend together, estimated 100,000 Americans may pass away. Some people have said 100 to 200,000 Americans may pass away before this is over. When is it over? When you achieve what they call herd immunity. How do you say 100 to 200? That's a broad range. Well, it goes back to the other point. Nobody really knows. But 100 to 200, you're saying a significant amount of people lose their lives. There is a group that is funded by the Gates Foundation, thank you very much, Bill Gates, that projects 93,000 Americans will lose their life by the time this is over. That model suggests 16,000 New Yorkers will pass away by the time this runs its course. My guess is, so when Dr. Fauci says 100,000, there are models out there that make these types of projections. And what would that mean to New York? That would mean about 16,000. Frankly, that would mean that New York is only 16% roughly of the number of deaths. I don't even understand that, since New York is so much higher right now. But what that does say to the rest of the nation is, this is not just New York. If you believe these numbers, 16,000 deaths in New York, that means you're going to have tens of thousands of deaths outside of New York. So to the extent people watch their nightly news in Kansas and say, well, this is a New York problem. That's not what these numbers say. It says it's a New York problem today. Tomorrow, it's a Kansas problem and a Texas problem and a New Mexico problem. That's why I say to my fellow governors and elected officials all across this country, look at us today, see yourself tomorrow. And let's address it in New York, and let's cooperate to address it in New York, because it's going to be in your town tomorrow, metaphorically. And if we learn how to do it right here, or learn how to do it the best we can, because there is no right, it's only the best we can, then we can work cooperatively all across this country. The other thing this model says, people say, well, when is it over? 2 weeks, 3 weeks, 4 weeks? This model projects you're going to have a high death rate through July. If this model is correct, this could go through the summer. Now, other people talk about getting back to work, starting the economy, April, May, June. This model says it could go on through July. Now the questions become nuanced. Well, could you still be dealing with the virus and get the economy up and running and get people out of their homes? Yes, I think there are ways to do both. Not picking between human life and the dollar bill, because no one is going to pick a dollar bill over human life. But can you come up with a public health strategy that is consistent with people getting out of their homes and starting to get back to work? Yes, you can. My opinion is the best way to do that is to come up with a rapid testing procedure where people can test, they know who's positive, they know who's negative, and they know who can go back to work and come up with a test quickly, and they're starting, that is readily available, that people can do at home, so you can take the test, know where you are, and we can start ending this terrible situation that we're in. Also, you come up with testing and rapid testing. Not only do you get up and get the economy running, you end the anxiety. The anxiety is what is most oppressive here. Not knowing if I'm positive, if my friend is positive, if my loved one is positive, not knowing when this is going to end. The anxiety of dealing with this isolation day after day after day. It's like a bad Groundhog movie, you know? Day after day after day. When does it end? How does it end? I don't know. I'm out of control. I think that testing is going to be the best mechanism to try to work through that. On the good news front, we have new testing available in New York. Regeneron, which is a great New York company, has created 500,000 testing kits at no charge. Thank you, Regeneron. And they are distributing them across the state. Corning, another great company, has donated 100,000 tubes and $500,000 at reduced cost, so we can do more tests. New York is very aggressive on testing. We have been from day one, and we think that has helped us slow the spread of this virus. My favorite topic, young people must get this message, and they still have not gotten the message. You still see too many situations with too much density by young people. They can get it. They're putting their lives at risk. This can kill young people, rare circumstances, but it can. But you get infected, you give it to someone else. So think about somebody else. And I've said this 100 different ways. The compliance is still not where it should be. You saw the models on the differential in the compliance versus major compliance and minor compliance. So we're going to take more dramatic actions. We are going to close down the New York City playgrounds. I've talked about this for weeks. I warned people that if they didn't stop the density and the games in the playgrounds, you can't play basketball. You can't come in contact with each other. That we would close the playgrounds. I've spoken to Speaker Johnson from New York City, who feels very strongly about this, who did from day one. We agreed initially with the mayor that we would try compliance, and the mayor was going to try to use the NYPD to enforce compliance, social distancing in playgrounds. It is still a problem. We're working with the speaker, we're working with the mayor, but we're going to close down the city playgrounds and leave the open spaces available. So use the open space in a park, walk around, get some sun, great. No density, no basketball games, no close contact, no violation of social distancing, period. That's the rule. Other good news, we are working with all the hospitals in the state to do something they have never done before, which is to act as one, to cooperate, to share supplies, share staff, support one another, shift patients among hospitals, which really has never happened to any great extent. And the hospitals have been very cooperative, and I want to thank them very much. In this war, we must plan forward for the next battle, meaning we have been behind from day one. This virus has been ahead of us from day one. You don't win a war that way. The next battle is the apex. The next battle is on the top of the mountain. You see that curve? You see a curve? I see a mountain. The next battle will happen at the top of that mountain. That's where it is going to be joined. And that's where the enemy either overwhelms our healthcare system or we are able to handle the onslaught of the enemy at the top of that mountain. And that's what we're planning for every day. But I want to offer you a different perspective that I'm starting to think about, and I think we all should start to think about. As a society, beyond just this immediate situation, we should start looking forward to understand how this experience is going to change us, or how it should change us, because this is going to be transformative. It is going to be transformative on a personal basis, on a social basis, on a systems basis. We're never going to be the same again. We're not going to forget what happened here. The fear that we have, the anxiety that we have, that's not just going to go away. When do we get back to normal? I don't think we get back to normal. I think we get back, or we get to a new normal, right? Like we're seeing in so many facets of society right now. So we will be at a different place. Our challenge is to make sure that transformation and that change is positive and not negative. Let's make sure we're taking the positive lesson and not the negative lesson. You could get wary of intimacy and contact and density. Social distancing, don't go near anyone. What a terrible thing to live with as a human being. What a cruel torture. Isolate yourself from other people. Be afraid of hugging someone. Just think how emotionally and personally repugnant that concept is, right? We crave human connection. And now we're being told that could be dangerous. You can't kiss, you can't hug, you can't hold hands. So how we come out of this and making sure that it's positive and not negative. how do we learn from this, and how do we grow from this, right? Society life, you will get knocked on your rear end. You will deal with pain, you will deal with death, you will deal with setback, you will deal with suffering. The question is, how do you get up? Well, first, do you get up? And second, if you get up, how do you get up? Do you get up smarter? Do you get up wiser? Or do you get up bitter? And do you get up angry? And do you get up fearful? We are in control of that. And we have to start to think about that. And we also have to be smarter from what we went through. How do you make the economy more resilient? What happens when something like this happens again? And something like this will happen again. Oh no, this is a once in a lifetime, never again. Something like this will happen again. We're seeing it in the environment, we're seeing it with floods, we're seeing it with hurricanes. Something like this will happen again. You can't just turn off the economy like a light switch. How do governments work together? You can't figure it out on the fly, what the federal government does, what the state government does, what the local governments do. Figure it out before. Learn the lessons from this. Telemedicine and teleeducation. We have to close the schools. Well, why weren't we ready with a teleeducation system? Why weren't we better at telemedicine? Why didn't we have that capacity rather than having people wait on all these lines to come in to get the same basic diagnosis and the same basic advice? Why don't we have medical supplies made in this country? Why are we shopping in China for basic medical supplies? Why don't we gear our medical research to these types of threats and challenges which we know are on the horizon? We know these viruses are changing. We know that they mutate. Why don't we get ahead of it? You still have to run society. Let's talk about first responder capacity. We now have first responders who are getting sick, and the workforce is dropping. Well, that was inevitable, right? That was going to happen. What's the backup to that situation? And let's talk about societal stability and engagement at times of crisis. You can't just tell everyone, go home and lock your doors and sit on your couch and order takeout for the foreseeable future. That's not who we are. It's not even a mental health issue. It's just a personal health issue. It's how we relate to one another. We're not built to be isolated for long periods of time and not have human contact. So how do we deal with that? And these are the types of questions that we have to start to think through. But not today. That is the next challenge, I believe. And that is what we're going to have to think about soon. But for now, one crisis at a time, as they say. And we have plenty to handle with the current crisis, preparing for the battle on the Mount, which is what we are doing every day. And that's what we are doing. And not only are we doing it, but we have to succeed at it. You know, government process is very good at saying, well, we're trying, we're working on this, we're doing our best, we're doing our best. Winston Churchill, it is no use saying we are doing our best. You have got to succeed in doing what is necessary. Tad harsh goes with that expression, which I think you could say tad harsh, handsome, but a tad harsh, but it's true. And that's what I say to my team every day. This is beyond best efforts. This is beyond I'm working very hard. We have to get this done. We have to succeed. We have to find a way. We have to make it happen because too much is at stake. Last point on a personal note, My brother Christopher, as I told you yesterday, tested positive for the coronavirus. He's at home. He's doing fine enough. He has a fever. He has chills, symptoms of basically a very bad flu. But I think this is illustrative in a number of ways. First of all, anyone can get this disease. Relatively young people, strong people, people who take a lot of vitamin pills, people who go to the gym a lot. Anyone can get this disease. There is no superhero who is immune from this disease. That goes for a New Yorker, as well as a Texan, as well as a Californian. Anyone can get it. No one can be protected from it. I couldn't protect my own brother. With all he knows and as smart as he is, he couldn't protect himself. So anyone can get it, and everyone has to be protected. I understand the data. I understand 80% self-resolve, 20% go in the hospitals. Christopher is not in the category that is problematic. By all the data, he should have it. He'll have it for a period of time, and he will then resolve. If he has bad symptoms, he'll go into the hospital, he'll be treated, and he'll be released. That's what all the numbers say. Even though that's what all the numbers say, when he told me he had the coronavirus, it scared me. It frightened me. Why? Because we still don't know. We still don't know. And even if there's just a 1%, 2% chance, it's frightening. It is frightening. It frightened me. And I deal with all sorts of stuff. And I've seen all sorts of things. And it frightened me. Why? Because we're talking about my brother. We're talking about my little brother. This is my best friend. Talk to him several times a day. Basically, spend my whole life with him. And it is frightening on a fundamental level. And it's frightening because there's nothing I can do, and I'm out of control, and there's nobody who can tell me, and Dr. Zucker can't tell me anything, and Tony Fauci can't tell me anything because nobody really knows. And this situation is the same situation for everyone. For everyone. So yes, I'm frightened for my brother. I'm worried about my brother, as everyone is worried about everyone in their family and everybody they love. I take solace in the numbers and the facts, because you can't divorce yourself from the facts. Otherwise, you go to a place of irrationality. But we're emotional beings. And as an emotional being, it is frightening, and it is unknown, and it is threatening, and it is scary, and people are dying. He's going to be okay. I believe that. He's in his basement. I sent him over a book that could be helpful, Beginner's Guide to Striped Bass Fishing. I hope he picks up some tips from that. But I also want to say to him, because I want him to know, he found out yesterday morning that he had coronavirus. He did his show last night. He did a show last night from his basement. What a gutsy, courageous thing to do. And we talked about it. And in some ways, this can be very instructive, I think, to many people. Because everybody wants to know, well, what happens if you get coronavirus? All right, he did. And he does this show every night. Maybe some nights he won't be able to do it, but he does this show every night. So what's the positive? Show the country what it means to have coronavirus. And that information, that experience can be helpful to people. And that's why he did the show last night. Okay, I have coronavirus, but you know what? Here I am, I'm doing my show. I didn't fall over, I didn't collapse, it's not a death sentence. Here I am, I'm doing my show. Kudos to him. My pop would be proud. I love you, little brother. And even though this isn't a flattering picture, I did not pick this picture with your mouth open, but it is suitable in some ways. Any questions, comments?
Governor, policy for posthumous testing of suspected cases.
If you could repeat that, please, because I missed it. Also, let's do any questions on coronavirus. If you want to do questions on budget or anything else, let's do them at the end. But I'm sorry, I didn't hear your question.
What's the state's policy or procedure for posthumous testing of suspected coronavirus cases?
What's the state's policy for posthumous coronavirus testing? I have no idea. Do you know?
This is based on a clinical picture, right? So if someone died as a result of respiratory illnesses, the person would be tested to be sure and try to figure out what happened to them, because there are contexts that that person has been exposed to.
So the death toll includes people that tested positive for coronavirus, or also people who had coronavirus-like symptoms?
So when we hear, we know those who have died, and if they're tested at the time of autopsy, those are included in the deaths.
Governor, can you confirm that there were some patients who were moved from New York City to Albany Medical Center and I believe also Ellis Hospital as well last night?
Were there patients who were moved, coronavirus patients moved from New York City to Albany Med? Yes. And we've talked about, this is one state, this is one family of New York, this is one family of the United States of America, by the way. We support one another. In two ways. Staff from upstate hospitals will be going to downstate hospitals because one of the real critical situations are staff shortages and staff exhaustion. So upstate staff will come help the downstate hospitals, and downstate hospitals who are at overcapacity can transfer patients to upstate.
Is it safe to move COVID patients who are being
It depends on the patient. But if they're in a place where the hospital can't treat them, then it's better to move them and be in a hospital setting where they can get treated.
So if we're doing this now, does that mean that the downstate hospitals are full? I know that the DOH has data on beds, including ICU beds. Can you make that available? And also, if you said 110,000 beds for COVID, what is the total capacity? Is it still 140,000?
About 140. 110 for COVID would suggest you have 30,000 non-COVID patients. We tried to bring down the patient count by mandating no elective surgery that was non-critical. So people are not going to the hospital right now to have a hip replacement unless they really need it. They're not going in for any type of elective surgery. So it brought the number of patients down so we could get more COVID patients in. The transfer from New York City, the New York City Hospital to Albany Medical was more of a one-off situation, which had been individually arranged. We are now, Department of Health is now coordinating all transfers. And you're right, the first step is transfers within the system. So downstate New York, you have the health and H&H system transfer among the 11 H&H hospitals to balance load, balance capacity, and transfer among the private hospitals to balance load, then transfer among those two systems, and then worst case scenario, transfer upstate.
So how much capacity is left between H&H and the private hospitals? And I guess Long Island and Westchester too.
Yeah, they are not at capacity now. It depends on how fast that curve goes up. We monitor it on a daily basis, and that's the $64,000 question, Jimmy, is when you get to the apex, you will be over capacity. Any of those models, by the way, say you are over capacity. You are over 100% by any model at the apex.
Who determines, Governor, and what is the criteria for moving patients from New York City into upstate hospitals? Do they have local connections, or is that just a medical decision?
It's going to be the transfer that happened was basically a one-off because they were hospitals that had a pre-existing agreement. But what will happen going forward, the battle on the Mount, will be capacity. You fill all the downstate hospitals, and you're over capacity on all the downstate hospitals. You then have Javits Center as a relief valve. You have that ship, the Comfort, as a relief valve. But they only take non-COVID patients. You try to transfer to Long Island. If Long Island is at capacity, then you move upstate. It's a pure capacity issue, pure systems management issue.
Several New Yorkers sort of shoulder to shoulder watching the ship come into New York. What more can the city do?
We are going to continue monitoring New York Governor Cuomo updating us on the coronavirus outbreak. One of the headlines there, all New York City playgrounds are being shut down and leave open spaces available. But now we're going to turn to New Jersey Governor Phil Murphy, who is live in Trenton with an update on the virus. Let's listen in.
To her right, state epidemiologist, Dr. Christina Tan. Dr. Tan, honored. And to my left, at the far end, State Police Superintendent Colonel Pat Callahan. I want to give a shout out. I know he gave me a shout out, and the shout out in return is richly deserved to Governor Andrew Cuomo. And you can't do this by yourself. You can't, and no matter how good you might be within your own borders, you need partners, in particular your neighbors. And there has been no better partner than Governor Cuomo. And I would also have on that list, high on that list, Governor Lamont in Connecticut, Governor Wolf in Pennsylvania, Governor Carney in Delaware, and governors from around the country who are not contiguous and are not directly neighbors, but folks with whom we have shared best practices, compared notes. We're all trying to learn from this at the same time. We got on this very early. We started meeting and speaking about it in January. I think I established our whole of government task force on February 2nd. But it doesn't make it any easier. And I know Governor Cuomo was early on this as well. But we're in the fight of our lives. Let there be no doubt about it. And it helps to have partners. I also want to acknowledge the Director of the Department of Homeland Security and Preparedness, Jared Maples, who's with us. As we have done of late, I'm going to start with a report on the new cases and, sadly, the newly reported COVID-19 related deaths. Over the past 24 hours, we have received an additional 3,649 positive test results, pushing our state total to 22,255. Judy will go through those positives in more detail. And during the same time, since yesterday, we sadly have lost another 91 of our fellow New Jerseyans to COVID-19 related complications. This means we have now lost a total of 355 members of our great, blessed, and diverse New Jersey family, and it gets no easier to report that. I should note, if you're doing the math at home, that 3 previously reported deaths are undergoing additional verification, so they have been removed from this count pending those results. And I think we alluded to this yesterday, Judy, that in certain places, particularly long-term care facilities, cause of death can be complicated. You've got a lot of end-of-life situations, sadly, to begin with, and then you add this virus on top of that. Every single one of these lost lives is irreplaceable, period. We pray for their souls. We pray for their families and friends. One of those we have lost during this emergency was Janice Prochel of Teaneck. You can see Janice's beautiful picture there on the left as well as on the right with some of the young folks in Teaneck. She was the founder of the Helping Hands Food Pantry that has fed countless families for more than a decade. She was active in her Temple Emeth, and was a past president of the Teaneck Rotary. She was 60 years old, and I quote Teaneck's extraordinary mayor and the township of Teaneck, as they put it, quote, "They lost a true woman of valor." I would expand on that to say that we have lost at least 355 people of valor up and down our state, young and old, persons of all backgrounds, and we mourn for each of them from afar. And even in mourning, we have to continue practicing our social distancing. As I said yesterday, we all have to remember to stay at home before this hits home. The only way we can protect our families and our communities and to flatten the curve behind us so we don't have to mourn one more or more precious lives is by taking social distancing to heart. Last week, I noted the words thanks to Pat Callahan of Father Jim Greenfield, the president of DeSales University, who said we should think of this as a time of social solidarity because by staying apart, we're actually coming closer together in common cause to defeat COVID-19. And I feel that. I feel that in my bones. I feel it all over the state. I hear it all over the state. This perverse reality of, on the one hand, being alone and isolated and distant from each other, and at the same time feeling like we've never been closer together. By whichever means you think of this, whether it's Father Jim's social solidarity or the more commonly used social distancing, it is both our best offense and our best defense against COVID-19. Stay on the charts for a second. Again, the one on the left, and these are hard to read, but the punchline isn't hard to read. The one on the left is if we had taken a decision from moment one in January and early February to let this virus run amok, run its course, you see a huge spike in the need for hospital beds, almost 80,000 in a state with 18,000 hospital beds. So that's, we basically got a little north of 20% of what we would have needed. There's no state in America or the world that could have made up that gap between that blue spike and that red line that goes straight across. The graph on the right is a better reality. It's still not a perfect reality, but as you can see, the blue spike is a lot lower. It comes in at around 35,000 beds. And we've got, as I said, about 18,000 with plans to put a lot more in place. But at least you've closed that gap such that we're at 50% of what we need as opposed to, 20-ish% of what we need. Our job collectively, the 9 million of us, our job is to flatten that blue curve even further. That right graph assumes an average performance based on prior pandemics. We are not an average state. We are the quintessential American state. We can do the impossible, or seemingly impossible. Our job collectively, all 9 million of us, is to take that right curve down as far as we can take it. Judy and Christina and their colleagues and Pat and the Army Corps and FEMA, they're working on taking that red line up. So as we bring the blue line down, they bring the red line up, and God willing, we meet in a place that allows us to get through this with a healthcare system that is up to the task before us. Switching gears, last night I spoke and had the honor to speak with Admiral Dr. Brett Giroir, and I received word from our federal partners that after my repeated and our repeated requests, another 350 ventilators are being released from the Strategic National Stockpile and heading to New Jersey. This is on top of the 300 that we took possession of, I believe, yesterday morning, and that we're checking and going through, and which we are testing, as I say, and preparing to deploy. And this is also on top of the 200 that, John, you originally asked about that we had gotten some weeks back. I want to give George Helmy a particular shout out. I don't know where we'd be without my chief of staff, who was at the Rock in the war room with Pat and Jared and others, and just want to give him a huge shout out. So if you add the 200 from a couple of weeks ago to the 300 we got yesterday morning to the 350 that they agreed to give us last night, which I believe are en route, that means we've received a total of 850 additional ventilators. But we still need more. And I will continue to press the White House, FEMA, and frankly anyone who will take my call for more ventilators, more PPE, more direct state aid, whatever it is that we will need to not only get ourselves through this crisis, but as I've said many times, and we will, to come out stronger on the other side of it. I am grateful again to President Trump, Vice President Pence, the White House team, and FEMA, among others, for working with us to get these necessary items. And if they're listening, I just want to warn you ahead of time, you'll be hearing from me and from us again real soon. And make no mistake, while every bit of federal assistance is essential, New Jersey continues to lead on its own. Yesterday, we showed a slide that laid out nearly 1 million pieces of PPE we have secured and distributed to the front lines of this war. The state has continued to lead, and I'm proud to announce that we have on our own procured nearly 10 million pieces of personal protective equipment that are beginning to flow into our warehouses and will be allocated to the front lines. Nearly 10 million pieces. We are not in the PPE business in a normal state of play. This is not a line of business that the state of New Jersey, or frankly, I'm sure any other state, is normally in. But I am proud to say that our colleagues in state government, including the folks with me today, have risen to this extraordinary challenge, and we have procured on our own, in addition to whatever we're getting out of the federal side, nearly 10 million pieces of personal protective equipment. While these items come at a significant cost to the state, and by the way, significant as in tens and tens of millions of dollars, I have said definitively that there is no price too high to save a life, and there is no price too high to protect our healthcare workers and those in the front lines of the battlefield that we find ourselves on. These products will be hitting our warehouses in waves in the coming weeks and will be used to backfill the depleted supply chains of our healthcare networks. We have their backs, and we will not let them fail. A few other announcements, please bear with me. First, on testing. Of our 2 FEMA-partnered drive-through sites, tomorrow, April 2, only the Bergen Community College site will be open, starting at 8 a.m. The PNC Bank Arts Center site will be closed tomorrow. To get tested at Bergen Community College, you must be a New Jersey resident, and you must be exhibiting symptoms of respiratory illness to get tested. And as I mentioned yesterday, there are more testing sites coming online and available across the state. I won't show my normal exhibit, but I counted now at least, depending on how you count them, at least 32 testing sites. Please visit our general website, COVID, as you could see it up behind me, covid19.nj.gov, to find the nearest testing site near you, and to also take a self-assessment. So there's a symptoms page on the website. So far, just shy of 180,000 folks have gone on that page to assess their own symptoms relative to expected symptoms of COVID-19. And I would also say, as it relates to testing, I mentioned this several times, in a perfect world with full supplies coming from the feds, both of the stuff we need to collect specimens, but also the personal protective equipment to protect the healthcare workers taking the specimens, we'd be testing everybody. That's a perfect world. South Korea. We have to play the hand that we have. We don't have those supplies at the level we needed them from day one from the federal side. So we have been testing and will continue to test symptomatic persons. That's not only the smart thing to do for the individual who's sick, clearly, but also it gives Judy and Christina and their colleagues an incredibly valuable data, both the positives and the negatives. In a perfect world, and we're not in a perfect world, Judy has mentioned this in long-term care facilities. There's now a study that's coming out of Minnesota, which Vin Gopal, who's been really good in working with us, brought to my attention just before coming over here. There is an ample amount of evidence, and I think you've seen it again in long-term care facilities, that it's the asymptomatic workers who are going into these facilities who are unknowingly, unwittingly, potentially passing on the virus. So if I had a perfect world, the next ring out would be, I suspect Judy and Christina would join me, would be testing all healthcare workers, symptomatic or not. We just are not in that mode because we don't have the supplies that we need to do that. But many of you asked me offline, what's the next ring out? That would be I'd raise my hand for the next ring out, because then we would at least be able to get a sense of how much of this is traveling in to things like long-term care facilities. Switching gears completely, to mirror the action already taken by the IRS, I am extending the New Jersey income tax filing deadline for both individuals and businesses to July 15th. This is an automatic extension. Again, any business or resident who has not yet filed their income tax returns for 2019 now has until July 15th, and there is no need to file for an extension. This extension is automatic. Second, and certainly relatedly, as it was announced earlier today, Senate President Steve Sweeney, Speaker Craig Coughlin, and I reached an agreement, and by the way, it wasn't terribly hard to reach this agreement, to extend the current fiscal year deadline from June 30 to September 30. We will work together to enact a supplemental appropriations bill to carry government operations from July 1 until September 30, and then work to enact a final fiscal package to cover next year's fiscal year, which is from October 1, 2020 until June 30th, 2021. We are taking this unprecedented step for a couple of reasons. The first is the necessity to have all hands on deck to see us through this emergency. We simply do not have the luxury of time. We must all be focused on our need to see our state and our people through this emergency and to ensure that our immediate needs are met. And let's not forget that now is not the time for us to have packed hearing rooms and a packed State House. We must practice the social distancing that we are preaching to keep everybody safe. The second broad reason is more pragmatic. We must enact a fiscally responsible budget. There is simply too much economic and fiscal uncertainty at this time. We will need a little time to emerge from this emergency and take full stock of the pace of our economic recovery so we can make smart decisions and enact a well-informed budget. But let me be clear, we will pass a fiscal 2021 budget that will run again from October 1st, 2020 to June 30th, 2021. We will use our time to ensure that the impacts of COVID-19 are properly and fully accounted for, and that so too is every penny of federal help that comes in, whether it's from the prior federal assistance packages or the next ones to come. And to be sure, as I said yesterday, I'll continue to push in my conversations, not just with our delegation, which is extraordinary, but with Leader Chuck Schumer and Speaker Nancy Pelosi and with the White House. I'll continue to push for the need for additional direct financial assistance for our state and the need for full SALT deduction relief. Again, I'm grateful to both the Senate President and the Speaker, to the Senate Budget Chair Paul Sarlo, Assembly Budget Chairwoman Ileana Pinto-Marin, and Minority Leaders Senator Tom Kaine and Assemblyman John Bramnick for their partnership. These are certainly unprecedented times, and they require unprecedented action and cooperation, but that action will ensure a more fiscally prudent state budget. It's an obvious point to make, but it needs to be made, and I think I've made it here already. When the feds extend the federal tax deadline from April 15 3 months to July 15, it is still within the federal fiscal year. It's an obvious point, but normally when folks file their income taxes on April 15 in New Jersey, we've got by the end of April a pretty darn good sense of what the income revenue side is going to look like for the balance of the year. And then you've got a couple of months, May and June essentially, to go through hearings and to negotiate a responsible budget. We want to give folks some breathing room. So extending the state tax deadline from April 15 to July 15 on the surface is a no-brainer, and that's why we pursued this. But guess what? April 15 is in one fiscal year, July 15 is in another. So we won't know until, in this case, until the end of July, where the numbers are coming out, and on top of that, we've got an extraordinary crisis. So the notion of extending the fiscal year to September 30th made sense at so many different levels. So let me switch gears again. Today, I also signed an executive order to provide additional flexibility and protections for our hospitals and frontline healthcare responders. This order removes bureaucratic roadblocks, as you can see, so we can more quickly bring more healthcare practitioners into our efforts, whether they be healthcare professionals who have recently retired or perhaps doctors who are licensed in other countries. The order also waives scope of practice requirements for advanced practice nurses and physician assistants who are already being called upon to shoulder extraordinary burdens. And my order makes clear that the healthcare professionals who we are calling upon to help in our state's COVID-19 response will be immune from civil liabilities for actions taken in good faith. And on the issue of volunteers, we still welcome anyone with prior medical experience to help us here in New Jersey. We urge you to join the thousands. Judy, I believe you told me a short while ago, 5,200 people who have already stepped forward to help by visiting covid19.nj.gov/volunteer, as you can see, and entering all of your information regarding your area of specialty. Your talents will then be matched to where our needs are the greatest, and we will get in touch with you. In fact, Judy, you told me you've got a team on this already. I believe you've got 5 nurses from your survey team sorting through names by credential and county, and we're available by license number, and I know you'll get into a little bit more detail on that. Let me just put on the Uncle Sam hat. We need you. If you're watching and you're a healthcare worker who may have retired from out of state, a doctor from out of the country, I know this is not covered by my executive order because it didn't have to be, but we're also unleashing nurses and doctors and others who are studying in their last semester of studies. We need you. We need you in a big way. And whether you're in New Jersey or not is not relevant. We'll take folks from anywhere we can find them as long as they're properly licensed elsewhere. Again, please go on covid19.nj.gov/volunteer. And I promise you, if you sign up, we're going to find a way to put you to work. Shifting other gears, I am also announcing that the deadline for eligible college students to apply for a renewal of state tuition aid for the 2020-2021 academic year has also been extended, in this case, from April 15th to June 1st. So to all students receiving aid through the Higher Education Student Assistance Authority, otherwise known as HISA, you have until June 1st to get your FAFSA form in. June 1st. Again, not April 15, but now June 1st. Next, the Economic Development Authority's application window for its newly created Small Business Emergency Assistance Grant Program will be open at 9 a.m. this Friday, April 3rd. Again, that's this Friday morning. The application will be posted on our COVID-19 Business Information Hub, and I'm going to give you 2 choices here. The one you see behind me, cv.business.nj.gov, again, cv.business.nj.gov, but that's also achievable by going on the central repository, covid19.nj.gov. This grant program is intended for small businesses that are facing a dire need for direct grant assistance for survival. Again, the grant application window will open at 9 a.m. this Friday, April 3rd, and small business owners can either go to cv.business.nj.gov or go to our central website, covid19.nj.gov. Switching another gear. Throughout the past several weeks, I've highlighted many of the New Jersey businesses and corporate citizens who have stepped up with meaningful support as we all work through this emergency together. It really does take a village. Today, I learned that the New Jersey Devils and owners Josh Harris and David Blitzer will be making a direct and significant donation to the RWJ Barnabas Health Emergency Response Fund. This donation will help RWJ Barnabas purchase much needed personal protective equipment for its frontline health responders. The Devils have a long history of support in the community, and I thank them for stepping up to help once again. And notwithstanding the fact I was born in Boston as part of this agreement, I have committed to Josh and David to become forevermore a New Jersey Devils fan. Also, we were informed that First Energy, the parent company of JCP&L, is also making a significant contribution to food banks in the areas in which it serves, on top of accelerating its giving to the United Ways in its service areas. This is a great reminder that it's not just our public health and safety responders who need a helping hand right now, but there are many families who also need help to put food on their tables. And I thank First Energy for taking this step. And there was a striking article in today's New York Times on the front page of how many people are going to food banks who have never been to them before. It is overwhelming the impact that this emergency and this crisis has had on families all over our state and our country, and indeed the world. Another gear change, Judy, if I may, before we hand things over to you. Tomorrow morning, I will be visiting the Meadowlands Convention Center in Secaucus to tour the field medical station or hospital that is being stood up there. I will be with Major General Jeffrey Milhorn, the Commanding General of the U.S. Army Corps of Engineers, North Atlantic Division, and Lieutenant Colonel David Park of the U.S. Army Corps of Engineers, who we all met sitting where Matt is sitting today last week. Colonel Pat Callahan will also join us as well. Our briefing, and this is only subject, Mahen, to whether there's a White House VTC tomorrow. There have been Mondays and Thursdays over the past several weeks, but unless you hear otherwise, we'll be back here in this same room at 1 p.m. tomorrow. I also have to go off script and make a final note that today is traditionally Census Day. And as I mentioned on Saturday, I believe, being counted in the census is something you can do while practicing that critical social distancing. Making sure every New Jerseyan is properly and accurately counted in the 2020 census is incredibly important. The census is more, and this is really important, folks, and we're living it right now. This is more than just a population count. It's the data that the federal government, and quite frankly, that we use in state government, rely upon to make decisions that impact our communities. We know that New Jersey was undercounted in 2010, and because of that, we have left, over the course of the past decade, by the way, and even today when we really need it, untold billions of dollars in federal aid on the table. And if that money isn't coming to New Jersey, it's going to go to some other state. Let's make sure that we get it here, and God knows we need it. So take a moment, as you can see, go online to 2020census.gov, 2020census.gov, and make sure you are counted in census. That said, I want to say something that I've said every single day we've been together. I want to thank every single New Jerseyan who is doing their part to get us through this crisis. Whether you're a frontline, essential worker keeping our communities going, or simply doing all that you can by social distancing and staying home and washing your hands with soap and water, even the little things, everything we do together will get us through this crisis. And we need all 9 million of us to do just that. And I want to thank, Pat, the men and women of the New Jersey State Police who are partnering, a particular shout out with the Ocean County Prosecutor's Office, the Ocean County Sheriff, and the Lakewood Police specifically for their frontline work to ensure full compliance with our stay-at-home order. In Lakewood, in Newark, and I know you're going to comment. If you don't mind, after Judy speaks, we'll turn to you for a quick compliance report. The overwhelming majority of folks in Lakewood and Newark and other places have been complying, as residents have been in communities up and down the state. But we need everybody to comply. Colonel Callahan, again, will comment on compliance overnight, but also to this particular partnership. And let's remind each other, this is no time to turn on each other. This is a time to come together. So we have zero tolerance normally. We have less than zero tolerance right now for any vilification of any community, any stereotyping. It is completely and utterly unacceptable. And we can say both things, that stereotyping and vilifying is utterly, totally unacceptable and won't be tolerated. And at the same time, we demand 100% compliance in every single community with the mandates that we have put forward. I can't say it enough. We are a family. We laugh together, we mourn together, we even disagree together. But right now, I've said this time and again, I think we're more together than we have been, at least in a long time, perhaps than ever before. We're New Jerseyans, we're tough, we got incredible backbones, we got character, we got attitude, we're tough as nails, and if we each do our part, we will get through this together and stronger as one family than ever before. Again, if you've got any questions, the website is behind me, covid19.nj.gov, and with that, please allow me to turn things over to the person who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Good afternoon. Well, as the confirmed cases of COVID-19 are increasing in our state, we're seeing an increasing demand on our healthcare system. We predicted a statewide surge during the second week of April. And as we broke the predictions down by region, we predicted that critical care capacity, particularly in the north, would be reached in the first week of April, if no further critical care beds were opened. Increasing critical care capacity is the key to managing the surge. Well, it looks like the surge is beginning to occur in the northern part of the state. Last night, 7 hospitals in the northern part of the state reported to the Department of Health that they were on divert status. That was divert status for various reasons. Some due to overcrowding in their emergency rooms, and some due to overall high census. We also got a call from 2 hospitals that they required ventilators. We were able to support those needs. And based on the governor's relationships that he's formed during this crisis, and Chief of Staff Helmy, we are able to secure 350 additional ventilators. And I understand that they're to be delivered today, and we certainly need them. Due to the activity in the northern part of the state, we're looking at possible alternative care sites. We are expecting the field hospital to be available next week and staffed accordingly. The field hospital will be available for lower acuity patients who can be safely transferred to that site. We're extremely thankful for the expertise of Dr. Jeff Brenner, a physician that may be familiar to all of you. He was the founding physician of the Camden Coalition, and Kathleen Stillo, who are on loan to the state of New Jersey from United Healthcare. They will be leading our alternative care site facilities. We cannot thank United Healthcare enough for sharing such outstanding professionals with us. As the governor shared, we now have 5,200 volunteers. About 35% of them are licensed professionals, nurses, respiratory therapists, and some physicians. We have 5 nurses from our survey team sorting through the names, identifying their credentials, working with DCA for a quick check to make sure that their backgrounds are in order, and also sorting them by county. So our first priority with the 5,200 will be to fulfill the staffing needs of our field hospitals. Throughout our preparation and response, the department has also been working with healthcare facilities and providers to respond to their need for information. We've held meetings and numerous conference calls with a spectrum of providers. Today, we partnered with the Nicholson Foundation, Robert Wood Johnson Medical School, and the Office of the Attorney General's Division of Consumer Affairs to hold the start of a series of video conferences for primary care physicians and outpatient providers to share with them infection control protocols, the epidemiological perspective, and also the telehealth opportunities that are available to them.